Natural immunity has been in the headlines a lot recently. You may remember Jonathan Isaac, who plays for the Orlando Magic, said he won't get vaccinated because he's had COVID. We've also heard about natural immunity from a lot of politicians, like Florida Governor Ron DeSantis, who has claimed that natural immunity is better than the vaccine. It's also been used in court as law enforcement officials in California fight vaccine mandates. But we talked to experts who are very clear about this. They say natural immunity really varies by person and is most useful when paired with a vaccine. Natural immunity is your immune system's response to an infection. According to Dr. William Messer at Oregon Health and Sciences University, your immune system remembers the pathogens.
Through that memory, our immune system protects us from getting sick, or is trying to protect us from getting sick again with something that has made us sick once already.
But is the protection you get from natural immunity the same or better than the COVID vaccine? Like most things COVID-related, the answer is complicated. But several studies show while natural immunity does definitely offer protection against COVID, immunity varies greatly from person to person.
And what we and lots of other scientists have found is that there is a close correlation between how sick you got when you got COVID-19 and what kind of immunity you get. And basically, to get immunity equivalent to what we see with people who are just vaccinated, you needed to be hospitalized and you needed to be really sick.
Dr. Thomas Jean, the Oregon Health Authority's deputy state health officer, said it's not clear exactly how long that protection lasts.
But even for people who have tested positive, again, we don't know exactly how long that immunity lasts. And it really makes determining who is immune enough and for how long they are very difficult. And so that data is just a lot clearer for vaccines.
While natural immunity cannot be used as a way out of the state's vaccine mandate, it is taken into account when it comes to some OHA policies. For example, according to OHA's COVID guidance for schools, if a student has had COVID in the last 90 days, they don't have to quarantine if they're deemed a close contact of someone else who tests positive.
And we know that COVID-19 does provide some natural protection, and the current evidence indicates that reinfection is very uncommon in the 90 days after that initial infection.
What is clear, according to researchers at OHSU, the people most protected from COVID are those with natural immunity who also get vaccinated.
So someone who's been previously infected and gets vaccinated has essentially all of the benefits of stimulating their immune system to respond and expand again with the vaccine without the risks of actually having been infected a second time.
I'm Kristen Severance, KGW News.